Dizziness ranks as one of the most common reasons people visit the doctor. In fact, the most recent statistics show that Americans spent a head-spinning $4 billion on ER visits in 2011. Dizziness has many possible causes, including inner ear disturbance, motion sickness, and medication effects. Sometimes it's caused by an underlying health condition, such as poor circulation, infection, or injury. The way dizziness makes you feel and what triggers it provides clues for possible causes. How long the dizziness lasts and any other symptoms you have also help pinpoint the cause. The specialists at Lake, Ear, Nose, Throat, and Facial Plastic Surgery explain how they search for the underlying causes of dizziness using vestibular testing.
You know, dizziness for the aging population can be a pretty serious factor when you incorporate fall risk. I primarily perform vestibular function tests for patients suffering from dizziness. Vestibular is actually a system within your body, and that component comprises of the vestibular nerve in the inner ear. The physician may notice through their evaluation the patient's inability to perform certain exercises or walk properly, and then that would lead to other questions from the physician. And then if the physician determines or suspects certain issues in balance, then that's where that would trigger an order for vestibular function testing. Probably the most common form of that is video nystagmography, and that's used to detect what's called a nystagmus. Nystagmus is an eye twitch or an eye move that is commonly associated with dizziness. So anytime anyone would become dizzy, they will have what's called a nystagmus. And that's just a reaction that happens naturally. Everyone gets it. And then you use that nystagmus to analyze where the dizziness is coming from. 50% of dizziness, or people suffering from dizziness, is going to be an inner ear issue. For the most part, the way that you treat and fix some inner ear disorders are done through what's called vestibular rehabilitation. And that is a type of physical therapy in order to realign or break up different what some people call debris or rocks in the ear. It's easily treatable, and they don't have to live with a debilitating sickness or dizziness all the time. And we see a lot of them, so we've been able to cure a lot of people, and so that they can move on and live fulfilling lives.
For more information on dizziness, as well as links to the specialist at Lake, Ear, Nose, Throat, and Facial Plastic Surgery, please click on the Spin Control Story link on our homepage at yourhometownhealth.com.